Well, good morning and welcome to our Spring into Motion online event for the BC Retired Teachers Association. We're really thrilled to have you joining us today. Today we've got an action-packed hour of stuff, and I'd like to get us started here. The first thing that's kind of exciting for me is just now, as we've gone to live broadcast, a lawnmower has started up just outside my window, and that's just because that's the way the universe works. So I hope you're able to enjoy the sound of someone else mowing their lawn, um, because that means you're not doing it right now. So spring into motion, let's talk about what we're going to do today. The reason that many of you have tuned in today is to find out if you have won one of these luxury spa retreat gift packages for you and a friend. And that'll be something we unwrap a little bit later, and looking forward to that. I'm going to be joined momentarily by BCRTA President Grace Wilson, and then we're going to learn a little bit about the UBC Pharmacy Clinic, which is a really useful service that we think our members will benefit from, and we want to tell you a little bit about that. We're going to have some insurance updates and what you need to know for 2021. It's been a strange year or so, hasn't it? So we're going to learn a little more about that. And on that same theme, travel has been shut down for some time, but as we said, our horizons look like they might be expanding a little bit in the months ahead. We certainly hope they are, as vaccines are getting ahead of this situation. And so we're going to talk about what travel might look like in the months ahead with our friends at Trip Merchant. And then we'll be joined by Jerry Teedy, president of Acer Cart and a longtime BCRTA personality, who's going to tell us a little bit about an upcoming initiative that our national body will be doing. So right now, I am thrilled to welcome on board here our president, Grace Wilson. Good morning, Grace.
Good morning, Tim. It certainly is a wonderful day here, and it's good to get together, even though we can't do it together.
Yeah, well, we are. I think that's one of the benefits that we've kind of been pushed into by this situation, is that we've all got a little bit better at running things on video and feeling comfortable about sharing information that way. So the first item we have up, Grace, is put together by our well-being committee and its chair, Terry Green. And I know you're really impressed by what they're doing there.
Yeah, I'm just very, very impressed, most impressed. One of the things that we wanted to do as a priority this year was to actually provide some online workshops for our members. And I know when I asked Terry to do this that it was going to be done very well. And I never gave him any directions. He just selected the topic. And I thought about it for a while, and I thought, there are many of us that take more than one medication. And when you go to the doctor, you get into the office and they put the timer on, and then they've got you restricted to one question. And so our pharmacists are beginning to play a much greater role in our healthcare. And so Terry selected a pharmacist who would actually provide us with some information today. And so I'm really excited about what we're going to hear.
Well, that's great. Yeah, we did feature the UBC Pharmacy Clinic in our Postscript magazine a few issues ago. And I think it's really informative article. The interview will be really useful, I think, to people. And the service is really something because it's personalized. Like you said, you go to the doctor, you always feel that time pressure, and the doctor's got a list of people waiting behind you. So getting into that calm analysis of things. And the other thing I've discovered too is that with the walk-in clinic and this specialist and your family doctor, you can get a lot of inputs for your medication, but there may not be that oversight. So Terry's done an interview with Tim Lim of the UBC Pharmacy Clinic, and let's run that interview right now.
Hi, and welcome to all of you who are logged into our virtual presentation today regarding the University of British Columbia's Pharmacist Clinic service to the citizens of British Columbia. My name is Terry Green, and I am Director on the Board of Directors of the British Columbia Retired Teachers Association. I'm also Chair of the BCRTA Wellbeing Committee. We are fortunate today to have with us Mr. Timothy Lim, who has a Bachelor of Science degree in pharmacy and is a clinical pharmacist and lecturer at the UBC Faculty of Pharmaceutical Sciences. Mr. Lim has had several years of clinical pharmacy experience at Royal Columbian Hospital in New Westminster prior to moving to UBC. Mr. Lim is passionate about providing culturally safe, patient-centered services to his clients. He has taken on roles collaborating with First Nations communities and advocating for the health of the LGBTQ through his network with the Pharmacist Clinic. Tim completed his university degree and training at UBC and then an accredited Canadian pharmacy residency with the Lower Mainland Pharmacy Services in Vancouver. Welcome, Mr. Lim, and thank you for agreeing to assist us with this presentation. To begin, could you explain for our audience in general terms how the Pharmacist Clinic operates and who can approach the clinic to seek advice and assistance?
For sure. Thanks, Terry, for the introduction. And hello, everyone. My name is Tim. I use he, him pronouns. I'm a pharmacist. To give you all just an overview of the Pharmacist Clinic, we are affiliated with the University of British Columbia Faculty of Pharmaceutical Sciences. And we are Canada's first university affiliated licensed pharmacist-led patient care clinic. So anyone in British Columbia is able to access our service where you'll get dedicated one-on-one time with an expert pharmacist. So we see patients on an appointment basis. The initial appointment is typically 1 hour long, where we use that time to get a good picture of the patient's overall health and then review their medications. In the appointment, we go through each of the medications and health conditions of the patient one by one to identify any potential or actual drug therapy problems. And then by the end of the initial appointment, we will work with the patient to determine the appropriate next steps. Oftentimes, this means liaising with the primary care provider, like your family doctor or nurse practitioner, or sharing our recommendations and booking a follow-up appointment with you to see how you're doing. And if we do have a follow-up appointment, it's usually 30 minutes long.
So how would those take place with people in British Columbia who don't live in the Lower Mainland? Would these appointments be by phone, or how would that work?
Yeah, for sure. So our services are provided at no cost to patients and all British Columbians. Currently, due to the pandemic and with current provincial stay-at-home orders and restrictions, we are providing care only through telehealth appointments. Telehealth appointments includes phone calls or video calls, so you have the option of doing either one.
Excellent, excellent. What is the process the Pharmacist Clinic uses if someone wishes to approach the clinic and seek advice and assistance?
Yeah, so folks can refer themselves to our clinic. They can also be referred to our clinic by their family doctor or nurse practitioner. But if they choose to self-refer themselves, there are two ways to schedule an appointment. They can call our clinic at 604-827-2584, or you can actually book an appointment online via our website.
Who do you have to staff the clinic? And how can a client be sure that the advice they are receiving is appropriate for their medical needs?
Right. So when you book an appointment with us, you'll first come into contact, and it'll likely be through the phone because we are working remotely at this time to abide with that provincial health orders by our fabulous medical office assistant, and her name is Rupinder. So Rupinder will help you prepare for the appointment by telling you all of the necessary equipment you need So if it's a phone, you'll just need a phone, but if it's a video call, you'll need to make sure that you have a laptop with audio capabilities, video capabilities, and she'll guide you through how to set that up. Um, Thereafter, we actually have the appointment where a pharmacist will call you or meet you online through that video call platform. We have 6 amazing registered pharmacists working at our clinic at the moment. And not only did we complete our pharmacy degree, we all pursued postgraduate residency training as well. So you can be sure that the care you receive is at the highest possible standard.
Excellent, excellent. There's been quite a bit of media discussion on the topic of overprescribing medication. It's been reported that 10% of seniors have more than 15 active prescriptions. And on average, every senior is taking about 5 prescription medications. And I think that that's about right for me. Even for me, I think about at the 5 prescription level. Is this a concern that you have, or is it more an issue of ensuring that medical practitioners and patients are aware of the interactions between medications?
Right. Yeah, it's a great question. And I think it is a concern that I have, and I think it's where pharmacists can play a large part in a patient's overall wellness. So like you said, the more medications you take, the more at risk you are to drug-drug interactions, potentially drug-disease interactions, possibly drug-food interactions, which can lead to side effects or adverse medical events like a fall, cognitive impairment, or even hospitalization. Also, the more medications you take, the more likely it is for folks to not take their medications as prescribed, just because it may feel a bit too overwhelming, or experience like financial burden just because of the number of pills they take, the cost that's associated with it. So there are many factors that can contribute to taking multiple medications. And I think this is where pharmacists can play a role, and just having an interview like this, we can just educate patients to know about this issue. Where this lies, or where this may stem from, is potentially the fact that patients have multiple medical conditions that's being managed by multiple specialists that focus on one condition. So when you have multiple prescribers, it can make it difficult to manage your medications overall. Again, this is where a pharmacist can help out by looking at your health holistically. We can optimize your medication and potentially reduce the number of pills you are taking. We can also support patients by educating them on these interactions and teaching them what to look out for and how to manage side effects if they were to occur.
I would imagine too, in some cases, people who have a large number of medications may even decide to cut down on their own without really assessing what they're doing. Oh, well, I won't take those many pills today, but maybe I'll take them tomorrow. So yes, it's good to have that kind of advice and understanding of what should be the daily practice or the regular practice for taking the medication.
Yeah, I totally agree. There are some patients that I've encountered where they decide to just cut down on medications on their own. And sometimes that can be harmful because you can, with certain medications, you can go through withdrawals. Or if you taper, or if you cut out a medication cold turkey without slowly tapering down the dose, you can experience like feeling unwell, or potentially some adverse events as well. So just having that expert pharmacist to help support you and just do regular check-in is kind of like a safety net to make sure that you're doing this appropriately.
So once an individual has come to the clinic and they've had their initial interview, there would be follow-up or opportunities for follow-up for that patient to report back and just to ensure that things are functioning well and properly.
Yeah, exactly. So when you book an appointment with us, it's not just a one-time, oh, hi, how are you? These are my recommendations type of thing. After the initial appointment, we will either book a follow-up appointment with you, and these follow-up appointments tend to be 30 minutes or so, or we'll liaise with your family care provider, so like your family doctor or your nurse practitioner, have a conversation with them, and then book a follow-up appointment. So you're getting that continuity of care throughout. It's not just a one and done type of deal here. Yeah.
Excellent, thank you. Could you provide maybe an example or two where people taking multiple medications might be in risk of a negative drug interaction or dangerous side effects?
Yeah, for sure. So I can list like 3 examples here. So
Great.
one example is a common medication that people take is known as a diuretic. Sometimes they refer to it as their water pill. Also, an over-the-counter medication that you can purchase, like Advil or Aleve, also known as ibuprofen or naproxen, they fall into a class of medication called NSAIDs. And so if you take those 2 medications on top of that and take a blood pressure medication like Ramipril or candesartan, that can actually adversely cause injury to the kidneys if you take them on a regular basis. So it's good to have a pharmacist review that and also review your kidney function to make sure that it's not causing harm. Another example of drug interactions is medications that you use to abort or get rid of migraines can interact with antidepressants, can interact with Parkinson's medications, and that can cause serotonin syndrome, which is basically high levels of a chemical called serotonin in your body. And if you're taking multiple medications that can increase the serotonin in your body, that can lead to things like agitation, confusion, an increase in your heart rate, muscle rigidity, sweating, tremors, things like that. And so, again, it's just helpful to have someone observe and make sure you're not experiencing those side effects.
Exactly.
Yeah.
So you've indicated then that also if people are coming to you and seeking advice, it's very important then that they keep track of what non-prescription medications they are using or may regularly use, so that you have an understanding of the overall picture of both prescription and non-prescription medications that they're accessing.
Exactly. And so that's actually part of our workup. In that initial 1 hour appointment that I mentioned, we will go through your medication. So that includes your prescription medications, your over-the-counter medications, so the non-prescription medications that you can just buy from a pharmacy. Nowadays, a lot of folks are on natural health products like and vitamins, herbals, minerals as well. And all of those can potentially interact with your prescription medications. And so our office assistant, in preparation for the initial appointment with a pharmacist, will encourage the patient to basically gather all of their medications, both the prescription and non-prescription ones. So then during our appointment, we can go through each one with you and make sure that none of these are interacting with one another.
Does diet play a part, or is it important that you have an understanding of sort of what kind of regular diet patients are using or having?
Yeah, that's a great question. And again, that's also part of our initial workup where we gather what's known as your social history. So your social history are things like your diet and your exercise, which could potentially affect your treatment or your medications as well. One prime example is if you have Parkinson's and if you take certain medications for your Parkinson's, it can be affected by protein. And so again, just having a general sense of your diet can help us figure out the appropriate times for you to take your Parkinson's medications. Another common interaction is like Synthroid, which is used for your thyroid. It can interact with like certain supplements like calcium, iron, and things. So just making sure that that is spaced out appropriately as well.
Okay. How does the clinic work with the medical practitioners of the clients who come to the pharmacist clinic? Do you contact them, or is that the role of the patient?
So after your appointment with the pharmacist, we will then determine whether it's necessary for, or if it's necessary for us to contact your medical practitioner or not. Sometimes the drug therapy problems that we've identified can be resolved by just talking to the patient or educating them around the issues. But if the recommendations that we have require a prescriber or a medical practitioner to be involved, then we'll reach out to that medical practitioner. And oftentimes that's through a doctor's note that we'll send to them. So we'll fax that over. We'll tell the patient to book an appointment with their family doctor, and then we'll schedule another follow-up appointment after that change has been made, just to make sure that they are doing okay.
Excellent. That seems to me like a really great service, because often I think there is a lack of communication or a lack of understanding between patients, their health practitioner, and their pharmacist who's giving them their medication. So I think that's an important aspect to bring that coordination in.
Exactly. Yeah, it's just to help with any sort of disconnect that might be in the patient's health care circle.
Yeah, yeah. Is it important, do you think, that patients have a clear understanding of the reasons why they are taking prescription and other medications, and that they can participate in the decisions about their treatment plan? And I'm thinking that in the context of, say, even my own case, where quite often, if and when I have to go to a doctor, and the doctor, I have a complaint, and the doctor says, okay, well, I think you should take this. Generally, my response is, oh, okay. And I take the prescription, and off I go to the pharmacist.
Yeah.
But without really ever, maybe not taking the time necessary with the doctor to discuss, okay, well, exactly why am I doing this, and what is it going to do, and getting a fuller understanding.
Yeah, I totally hear you, and I think this is a very important topic. I think it's important to have patients involved in their care. As healthcare professionals, we want to be as patient-centric as possible, and we want to empower patients by giving them all of the information they need to make a medical decision that best suits their needs, their values, and their beliefs. So this means discussing like the pros and cons to each of the treatment options. And so having that one-on-one appointment with a pharmacist, we can kind of talk about the pros and cons to each of the drug therapy that you might have been prescribed. Yeah, healthcare nowadays is kind of shying away from that paternalistic approach where the healthcare provider tells you to take this medication or tells you to do this because that's what's best for them. Rather, it's more of a collaborative approach now where we work alongside the patient to help come up with the best care plan for them. Because at the end of the day, it's your health and your wellness that we're looking out for.
And I think probably the end result would be a more successful treatment plan, because there's the buy-in then of all the participants, right? The pharmacist understands what's going on and says, yes, this is good. The doctor saying, yes, this is good. And that gives confidence and comfort to the patient who's saying, oh, okay, well, yeah, I understand this and this. Okay, I can accept this. And I would imagine then we would see much more successful outcomes from the treatment programs that are being provided.
Yeah, exactly. Totally agree there.
Excellent. How is the UBC Pharmacist Clinic able to offer services at no charge to patients, and is this combined with learning experiences for student pharmacists?
Yeah. So our clinic, I like to see it as a living lab and a site for practice innovation. It is a not-for-profit business because we are funded by the faculty itself, the Ministry of Health, and also through grants. So again, our services are provided at no cost to patients. Our clinic, because we're affiliated with the faculty, is also a site where learners with appropriate supervision can gain experience as they prepare to enter practice. So patients are always asked before a student is involved in their care, along with one of our clinicians. And if the patient says no, that doesn't affect their care in any way. So the pharmacy students who come into our clinic are usually in their final year of pharmacy school and have completed all didactic components of their pharmacy education. They are involved in the patient care by leading the patient appointments with the pharmacist supervising. So I kind of like to see it as, the patient getting two heads or two pharmacists at once. Yeah.
Right on. And
Yeah.
that's also then a wonderful service in terms of that it's affordable for British Columbians, but it also then provides training for our future pharmacists. So the pharmacist clinic is providing a really valuable dual purpose, at least for.
Exactly. And it's really that experiential education that really solidifies the things that they learn in pharmacy school. And so it's definitely a benefit, not only for the patient, but also for the students, like you said.
Excellent. Um, could you provide us with a little bit of background regarding the UBC Pharmacist Clinic? When was it initiated, and what was the motivation for setting it up, and how long has it been in operation?
Yeah. So as our profession of pharmacy is evolving rapidly these days, our faculty, which is the only training site for pharmacists in British Columbia, has a leadership role to play and decided to establish a patient care clinic to model future pharmacist practice to help with the evolution of our profession. And so our clinic opened in November 2013, and we are getting close to that milestone of 20,000 patient appointments in the care of thousands of patients.
Incredible. That's wonderful. Wonderful. In review, how may the members from around the province of BC, Retired Teachers Association, access this service, and how do you ensure that the consultative service is kept private and confidential?
Yeah, so as mentioned, this service is available to all British Columbians. Technically, it's available to all Canadians. We've had, patients from Alberta, Ontario, other provinces call in for our service because it's free. And they can access this service because we offer telehealth services, so phones and video calls. Prior to the pandemic, we offered in-person appointments as well, where if the patient comes down to UBC, we can see them on an in-person basis. But again, due to the pandemic, it's been just phone calls and video calls.
Right.
And as I mentioned earlier, you can book an appointment by calling our clinic or booking an appointment online. So if you just Google UBC Pharmacist Clinic, there is a header where it says book online appointment. You just click on that and then it will give you prompts that you need to fill out, and then you can select when you would like your appointment. The fact that our clinic is an actual pharmacy and has a pharmacy license and operates like a specialist medical practice, as professionals, we are bound by ethics and laws in our behavior and how we respect privacy for all patients. Being part of the university as well, we have robust privacy and security procedures in place, and also a privacy officer within the clinic team to make sure that our practices are being maintained at a high level of standards. As well with the patient appointments, we share with the patients that, there are risks and benefits to phone calls or video calls, and we discuss that with them and making sure that we get their consent before moving forward.
Excellent. Excellent. Okay, well, I want to thank you, Mr. Lim, for being with us today and telling us about this valuable and helpful service for the seniors of British Columbia. And it's been a pleasure to meet you, and thank you very much.
Likewise, thank you so much.
Well, that's just terrific work, Grace, as you highlighted. Terry really dug into that with Tim, and my thanks to both of them for that excellent information about the UBC Pharmacist Clinic. Now, we want to make sure that everyone has access to that information, so I'm just putting up on the screen now the way that you can get a hold of them online. There's a long URL there that you can type out, make note of, and we're going to show this again later. The simple way is go to Google and type in UBC Pharmacy Clinic, and you'll see the results there. And that'll give you an opportunity to go visit their website or give them a telephone call. It looks like a really great thing to take advantage of at no cost. In other news, the lawn care is done, so I'm feeling a little happier about the background noise. That's good. Next item we have up has to do with insurance. And Grace, you know, as teachers, um, as a cohort, have pretty amazing benefits when they're an active teacher. And then moving into retirement, it's a whole new world. And one of the big tasks that BCRTA has taken on over the last few years is putting together and presenting to our members some good extended health care options around insurance. And that's become an important part of our service to members.
Yes, it certainly has. We've been so fortunate to actually work with Johnson's because they have allowed us to actually do a bit of negotiations around some of the things that we offer to our members, and we've done some. We've listened to our members about the things that they want, and so we feel very fortunate that we're able to provide this option to them.
And we do get a lot of positive feedback about that experience, that best friend experience that Johnson's contracted with us to give to our members. And I know that our pensions and benefits expert, Jerry Teedy, had a chance to catch up with Lisa Hansen from Johnson Insurance with a brief interview about what's going on in the world of insurance. And we've got that interview. Why don't we run that interview right now and see what they have to say?
Hi, folks. I'm sure most of you have met Lisa Hansen, our Johnson Insurance consultant, and she's here to fill us in on some of the latest developments with our Johnson Insurance programs.
Hi, Jerry. Thank you very much for having me be a part of your meeting today. And I do have some slides. I'm hoping you can see them.
They're all up there. So Lisa, our trip cancellation, trip interruption insurance is good, but it doesn't cover COVID-related incidents. When can we expect to see that change?
Well, I'm glad you brought that up. I have some hot topics listed here in the event that these things came up. So, and I do have a slide that will help explain what is covered right now. Yes, you are right. We are not covering trip cancellation and interruption under Medoc. Prestige and your standalone product do not cover for COVID at this point, but what we do cover is the medical coverage, and it's 5 million emergency medical coverage per person per trip under both of those. But I will say that we're going to probably have to take a wait and see on adding the trip cancellation and interruption coverage back in for COVID. I think as the vaccines roll out and as travel resumes again, we'll get a better understanding of what the industry looks like. The travel and insurance industry was hit very hard during COVID. 85 to 90% of the claims that we received were trip cancellation claims. And we just want to be more cautious. We want to bring you that industry leading product at the rates that you expect from us. And I'll have to say, stay tuned on this. We're working on getting that to you as soon as we possibly can. But I honestly don't see it happening in the September 2021, August 31st policy year.
Thanks. Every year we try to make improvements to our BCRTA insurance plans based on the input we get from our members. What can we expect to see this coming year?
We've got some big changes, and again, I'd like to thank all of the members who take the time to share their feedback with us about the plans that they purchased through us and other providers. The first item I would like to bring forth is that we are going to return to a September 1st to August 31st policy year. It was an 8-month policy year this year just because of the 4 months of premium-free travel that we gave at the end of 2020. So we'll be going back to business as usual. And then we've done some modifications to the plan. One of the things, and this applies to both Medoc and Prestige. So one of the things is that we've added an automatic extension for your coverage. So if you aren't fit to fly, even if you're no longer hospitalized, your coverage will get extended. We've tried to help with the customer journey for your members that were purchasing the supplemental travel product from us at renewal, they would have to call in to change their dates, and now they'll have a link where they can update online, so they don't have to call in anymore. Kind of speeds up the process for them. And then again, with respect to your members that were purchasing the supplemental plan coverage for the longer trips, if there was a need to return home, which happened with some of your members in the middle of a supplemental trip, and then they wanted to rejoin and their trip and were taking another extended trip, they would have to buy a secondary supplemental plan. We've changed the policy wording to accommodate this, so there's some savings to be had by those members in the event that this happens to them. We've included loss of limb and sight in our flight accident benefit, and then we've done some other additions here. We're still in the early stages of the renewal process, so these still are being worked out, and the policy wording is being worked out as well. We have included coverage if there's a change in health causing instability. So if your members need to cancel a trip when they experience a change in health, it would create an instability on the plan during their trip, they do have coverage for that now. Lost and stolen travel documents are covered. We've included coverage for guide dogs, and in the event there's illness, injury, or death of a guide dog. And we've improved our policy wording around persons with disabilities. Other covered events have been included, such as quarantine and hijacking and cruise cancellations. So details coming soon on how that works for your members. And then I believe you are wanting a reminder to our Prestige members in particular about if they put their travel coverage on hold during the pandemic, if they are adding it again, there will be a 90-day stability clause that's going to apply to them the first 90 days that they re-enroll under the travel. So a suggestion to me would be, or to give to your members would be, if you know your date you're traveling, you don't want that stability clause to impact you in any way, perhaps it's a good idea to just purchase the coverage 90 days in advance, and then write out the stability clause while you're at home. So then when you do leave, it flips to a sudden and unforeseen rather than a 90-day stability clause.
That sounds like good advice. Some of our BCRTA members cancel their travel coverage because they're not traveling now. When should they rejoin?
So it would definitely be, if you're worried about a stability clause under the Prestige, you would want to join 90 days prior to travel. And MEDOC, it'd be ideal if you joined before you left for the trip for sure. But when you know of the dates that you're traveling, good idea to give our staff a call and get some best friend advice, because you want that trip cancellation to be available to you for any trips that you booked. So we understand that everybody's kind of on a on hold pattern. So if you have a trip coming up, please just call us and we'll give you the best way to look after your upcoming adventure.
Is there anything else, Lisa?
As with any branch meeting, we always give best friend advice, and it usually is specific to insurance. This year, because of the industry just completely changing, we want to extend that best friend advice to reading all policies, including insurance policies, destination, hotel, airline, and tour operator policies. Understand coverage and maximums, policy exclusions and limitations. Really important before you book that trip to educate yourself before booking your travel. You don't want to get locked into something that's not going to work for you. Really recommend when you know you're traveling that you download that travel smartphone app that we have right there for you, and then you get up-to-date information on your travel destination. If you're curious about credit card coverage, you may want to visit this website listed here just to take a look at what's available. Always good to visit destination tourism websites. Travel Health Insurance Association is a great place to visit to get information, and we know it's overwhelming when we start this travel business again, and we're seeing a lot of travel policies that are out there that aren't covering COVID unless you purchase a rider, or maybe they do have COVID coverage, but it's at a sub limit. So if you're overwhelmed by the information in front of you, it's always best to call Johnson for best friend advice or visit our website. We want to ensure that you're in the right lineup for insurance. So please give us a call. We're happy to help you in any way and would love to see you traveling again.
Thanks, Lisa. And I'm looking forward to the day when we can go visit branches again, travel and see people in person.
Yeah,
Thanks a lot.
me too. Thank you.
Well, lots of good information there again, Grace. Another one of those issues where there's so many layers of information. It's kind of hard to take it all in at once, isn't it? One of the things that's really important to us as an association is to really stay in touch with where people are in terms of their EHC coverage and how they're experiencing that. Because as you know, there are two main plans that our members are signed up for. One is the Green Shield plan, that's kind of the default plan put on by the Teachers Pension Plan. And then there is the Johnson Prestige plan that we put together. One of the ways that we want to stay in touch with that, and I'm just going to share a link on the screen here, is with an EHC survey that we're putting together. And so folks on this call, if you're watching this live broadcast right now, you're the first to hear about this. This is a survey where we're reaching out to you and asking you to please let us know about your experience with extended health care, dental, those kinds of coverages. We really want to know what's working for you, what you're finding as a challenge, and we're really open to your feedback. It's really useful information for us to see how things are tracking for people on all those programs. Now, Grace, the topic comes up, of course, when it comes to insurance and traveling and trips and so on. We want to get all this going again. And I know you're sitting there in Nelson, which is sort of like the paradise of BC, and everyone wishes they lived in Nelson next to Grace. But even you sitting there in paradise, like to travel the world. And before this craziness hit, you had plans of yourself with our friends at Trip Merchant, didn't you?
I was scheduled for a trip to Vietnam and I was so looking forward to it. And then everything just came crashing down. So I've been waiting and waiting for things to lift so we can get that off the ground again.
Yeah, and I guess we're going to wait until things are safe to do that. But it's good to keep our eye on what those plans are and get them teed up and ready to go. So our friend Jerry had a conversation recently with Tom McLean of Trip Merchant, and they talked about what it's going to take to get going again, what that's going to look like. And so why don't we have a look at that interview right now?
One of BCRTA's affiliate partners is Trip Merchant, and that's the company that organized our very successful long stay to Portugal and our trip to Morocco, and the canceled Alaska cruise, canceled thanks to COVID. Tom McLean is the co-founder of Trip Merchant and the agent we work with here in BC. Now, as you can imagine, nothing much has happened with travel for the past year, but Tom's been very busy getting ready for the eventual return with some updates to their website and all of their programs. And Tom is here to answer some questions for us about travel. So Tom, what are the current rules for Canadians who wish to travel?
Yeah, so as of January the 7th, the government introduced new travel restrictions. So basically now if you do decide, you do want to travel, for example, let's just even say Mexico is a destination and you're coming back, you need to have a negative COVID test before coming back that has to be done 72 hours prior to your return. You also have to book into a government sanctioned accommodation for 3 nights because when you get back, you got to, wait for your results and get tested. So 3 nights. The government's saying that it might be up to $2,000. So I don't know if you need to book the penthouse at the Fairmont Hotel for that, but that's what you need to do. And even if it does come back negative, you still have to finish out your quarantine, your 14-day quarantine, when you get home. So, we're advising people that it really doesn't make sense to travel given those restrictions right now, even how much we want to. We would advise. And then also the other issue is, finding a place in the destination to actually get the test taken. So that's another thing that's a kind of an issue.
Thanks. So we're all anxious to go traveling again. What countries are likely to open up first?
Yeah, so if I look at last year, so after the first wave was done, we saw countries, particularly in Europe, that started reopening. So I would expect that the same thing is going to happen. So countries like Iceland have handled the pandemic well, and they were quite flexible with opening. So Iceland, the UK has also been doing very well with their vaccination, so that's going to help. Portugal as well, I expect. And depending on what happens in Spain and France and Italy, those, might come a little bit later. The US as well, I think is going to open, quite soon, probably this summer at some point, given how the vaccinations have been going. So those are the ones that I think are going to open at first.
Thanks. Our BCRTA travel insurance covers COVID if a person gets sick while they're traveling, but it doesn't cover COVID in the trip cancellation, trip interruption part. So what are the cancellation policies for flights and hotels and trips?
Yeah, I mean, it's going to vary, but, for the most part right now, like airlines, for example, they've been quite flexible. So Air Canada just introduced, as of April the 13th, you can actually book a flight and cancel and get a full refund instead of future travel credit, which is the way they were doing it before. As long as, and then it goes back to your original form of payment. So if you pay by credit card, it would just go back to that. Hotels have been also quite flexible. So, if we look at some of the bigger brands, Accor, which owns like the Fairmont and lots of other brands, or Westin, you can actually cancel up until 24 hours prior to your hotel stay and get a full refund on that as well. So, and the same thing like tour companies, for example, that's going to kind of vary, because when you're working with a tour company, they're having contracts with multiple hotels and they're selling different destinations. So the challenge is going to be, you really want to have a uniform policy across the board. So some of them have a future travel credit, okay, and then some of them, like Call It Vacations, which is one of our partners as well, they have a change of mind cancellation policy, which they've had for many years. It is still effective during COVID times, which means you can actually cancel for whatever reason up to 24 hours prior to departure. So, my recommendation is, and we look at all these things before anybody books to make sure that the customer knows, okay, what are the terms and conditions of the cancellations that are in place, because we don't want to put anybody in a tough spot either. So we make sure that they know what it is beforehand, and if it's something that is strict, we would advise against booking that supplier at this point.
Thanks. So we had scheduled an Alaska cruise for our members, and we think it was going to be very popular, but as I said, it was canceled due to COVID. When is cruising going to begin again, and where?
Yeah, so good question, Jerry. So, if we were living over in Europe right now, you can actually cruise with cruise lines that are actually based in European ports, but we don't. So, if we look at what Canadians can do right now, you basically can't really do any cruises at the moment. The Alaska cruise season was canceled by the Canadian government I think it was about 2 months ago for the season. Now, that doesn't mean that they're not going to reopen it, later on. They may, in August potentially, depending on the COVID situation. But, my recommendation is, if you're looking to ocean cruise and you're a Canadian traveler, that I would probably wait until 2022 till we have more certainty of what's going on. Because otherwise, you're booking, you're having to reschedule anyways. So that would certainly be my advice.
We have a group travel that's still kind of in limbo out there right now, going to Vietnam with an addition to Cambodia, if people wish. What happened to the people who booked that? And what's the likelihood of that trip happening this year?
Yeah, so we've had to obviously push that trip back. That trip was supposed to take place October of last year, and obviously COVID prevented that. So what we did is we changed the departure date. We made the deposits fully refundable, up until future dates. We've had to do that multiple times. So the trip is supposed to operate October the 25th of this year. We pushed the deposits to become fully refundable from March of this year up until the end of July. You know, and we're doing that because we want to have more certainty of what's going on. So, you know, we don't want to put passengers in a position where the deposits are non-refundable. We don't want to deal with that as well. You know, we don't also want to book any airfare, and you know, in that situation as well, until we have absolute certainty. So, you know, so the short answer for that is, you know, the deposits are going to be fully refundable up until the point where it's realistic that we look at the October departure. And if it's not going to operate, which right now we're looking at probably about a 30 or 35% chance of operation, to be honest, but things can change over the next month or 2 months. In July, we'll reassess. If we don't have absolute certainty by that point, you know, I think the best thing would be to push out that departure to the spring of 2022, and then, you know, and then reassess at a later date. So it is a challenge being a travel company right now. You know, this canceling and rescheduling and all this is not something that we enjoy doing. But obviously, we always err on the side of caution and have our customers' best interest in mind.
So is there an opportunity for members still to join that group? And you've already told us, I think, about the safeguards for canceling and postponing. But what is this COVID situation like in Vietnam?
Yeah, so they've done a tremendous job of handling the pandemic. So, you know, believe it or not, like their total COVID cases since the pandemic started is, as of today, we're looking at about 2,700 in total cases, which is basically our case count recently over a weekend. So they've really locked everything down right away. They took care of it right away. They've had a couple of outbreaks, you know, over the course of the pandemic, but, you know, they've basically tamped that all down. The people have been, you know, the general public have also been quite receptive and doing what they've been told as well, which has also helped. So, and the total deaths, I mean, it has been, I think, 35, you know, so they really have done a good job, but they've been very restrictive in terms of who they allow in. So right now we can't get there anyways. Cambodia, which is part of the trip, you can get there, but it's a mandatory 14-day quarantine. When you get there, you have to leave $2,000 US at the border, right, to cover tests and things like that. So, I mean, really nobody in their right mind is going to travel there at the moment, and we wouldn't advise anybody to do so. So, you know, and that's what we have to look at, right? So to make the decision on whether we're going to run it in October, you know, what's the COVID situation in Canada? What are the restrictions? What's the COVID restrictions? And what is the travel experience going to be like in the destination? You know, we want everybody to be happy going. So we still do have space. We have 24 people that are currently booked for the Vietnam, 20 on the Cambodia. We can accommodate up to 32. So we still certainly do have space for anybody that wants to be added as a last minute. Your pricing will be protected, you know, if you do decide to book. So if you did put a deposit at this stage, it is 100% refundable up until the end of July. And then, you know, and then you can decide to cancel off at that point if you're a new traveler, or, you know, or just push it out to the next date in the spring of 2022.
Thanks, Tom. I think you've answered my questions. We're going to go into a bit of other information about what's available through Trip Merchant now.
Okay, yeah. So basically, great question. So basically, I mean, we've got lots of different programs. We've got some long stays that we've got for next year for Portugal. You know, we've got you know, a St. Lawrence River cruise that we're doing this August for Canadian travelers. So we're hopeful that might be able to run. We've just launched a Newfoundland program as well for the end of August. Right now, Newfoundland is still under the travel bubble, but we're actually taking names for people that are interested in going on that trip. There's no deposits at this stage because, you know, you can't get there anyways. So we'll hold your space, reassess again. And then at that point, if the bubble's opened and we have the green light to be able to travel, then we can convert everybody to start booking and putting their money down for that trip. So yeah, we're working on a new platform, as you mentioned earlier. So this has been since July of last year. So there's lots of upgrades that we're planning for that. Lots more programs and a lot of different changes, video content, 360 content, guided trips that are virtually guided, so you can experience that right from the comfort of your own home. So, you know, hopefully we want people to be able to start being able to travel soon. I know we're all kind of tired of sitting at home, but we're getting there.
Thanks. That's good news for us serious travelers who are just chomping at the bit.
Yeah, I think we're all ready to spring into motion, Grace. we're all ready to move. Now, one of the things that's impressed me about the work that Tom McLean at Trip Merchant has done is he's really done a good job putting together packages of material. And we had some other video that's just too much for us to pack into today's live presentation, but I want people who are watching this right now to be aware of it. And I'm just posting a link on the screen right now for you to look at. If you go there, follow the links on our website. When you get onto the Trip Merchant site in the BCRTA section, you'll be invited to enter a password. And that is just as it appears on your screen right now, capital letters BCRTATM18. And that password will get you in there, and you can subscribe to the Trip Merchant newsletter, where you'll get a chance to see what's going on there. And they do have some good affinity kind of programs where you can add up some credits. If you go on one trip, you can get some credits on your next one. Well, Grace, there's a common expression that you often hear, that the next guest needs no introduction. And I think we've kind of reached the pinnacle of that here, the apex, perhaps even the apotheosis of the concept of needing no introduction. Since we've introduced this guy a couple times already, I'm wondering if you would do us the service, please, of introducing our next and very special guest.
Well, I'm very, very pleased to introduce to you Jerry Teedy. And he has just done amazing service for the BCRTA in a number of areas. But today, he's going to speak to us as president of the Canadian Association for Retired Teachers. Jerry.
Thanks, Grace. So building on the success of BCRTA's online conference, the Canadian Association of Retired Teachers, we usually refer to them as ACER-CART, is holding our first ever webinar and inviting our 165,000 members from across Canada to join in. We have two excellent speakers that are going to talk about the priority that we identified. That's the need for a national senior strategy to address the growing number of seniors and the number of seniors issues that have been there all along, but have been magnified during the COVID crisis. Our speakers are Dr. Samir Sinha. You may have seen him on TV as one of the experts addressing COVID-19's impact on seniors. Dr. Sinha is a leading expert and proponent of aging in place. I think all of us seniors want to stay in our own homes as long as possible because we've seen what conditions are like in some care homes. So Dr. Sinha looks at countries where home care is the priority and is properly funded, and he explains how that could be done in Canada. Then, the highest rated speaker at our own conference was Dr. Steve Morgan from UBC, who speaks on the need for and the advantages of a national pharmacare plan. I could happily listen to him again because his talk was so full of useful information. And while our government has promised pharmacare in the past, it did not make the budget. So we need to keep pushing for this. And who knows, an election may be right around the corner, and these two election issues are important for our members right across the country. So this is a great opportunity to become knowledgeable ourselves. Now you need to register for this conference ahead of time so you can get the link to attend. Tim's going to put up the web address, or you could find the registration link on the ACER-CART web page or the BCRTA web page. Please share this invitation widely, and I hope to see you there. Thanks.
Well, thank you very much, Jerry. It's always good to see you, and today we've seen quite a bit of you. So Once again, thanks for your immense contributions to our association, to this broadcast, and to the well-being of our members and now retired educators all the way across Canada. BC's prized export right there. So on the screen there, you see our preview of that Easter cart event that is coming up, and you'll be able to get those details in the weeks and months ahead as we get a little closer to that June 3rd date. You might want to make a note of that. It will happen on the morning of June 3rd, and we're looking forward to that. Well, Grace, I think we're getting to an exciting part of our session now. We're getting to a part where some people are going to not only feel happier, they're going to smell better. And personally, I always like it when people around me smell better. So this is an exciting point here. We've had, and I do mean this literally, thousands of entries into this contest. And now is the happy moment. And I'm going to ask you if you do the service, please, of announcing our first winner who's appearing on the screen right now.
Okay, this is a big moment. Winner number 1 is Vicki Burkholder, and she has a friend, Debbie, and they're going to share the basket. They're going to love it.
Yeah, each get their own basket. So let's just be clear about that. They don't have to share the basket. They're going to share the joy of each having their own basket, because if we ask people to share the basket, maybe the contest wouldn't end quite as well. So we're giving each person their own basket, and I get the joy of announcing our second winner, Karen Vance. Your friend Marie is going to be thanking you because the two of you are going to walk away with this Spa Retreat gift box package. And Grace, we have one more winner. I'll ask you if you could share that.
And our final winner is Sherry Susan Lee, and she has put down Meg as her friend, and both of them will get a basket. Thank you for signing up.
Yeah, very good. It's always fun to give stuff away, isn't it? Well, I have some thanks of my own now as we wrap up our broadcast pretty much on time. I want to thank everyone who tuned in. I want to thank the people who participated in putting this together behind the scenes and in front of the camera. And that, of course, includes you, Grace. Thanks so much for your leadership and for joining us today. Jerry Teedy, thank you. Terry Green, thanks for your work with the Wellbeing Committee and your interview. Lisa Hanson of Johnson, Tim Lim of UBC Pharmacy Clinic, and Tom McLean of Trip Merchant. Thanks for your contributions and for all you do. We really appreciate the work of our healthcare partners around the province and our Advantage partners who really give great service to BCRTA members. I promised you that at the end of today's session, we're going to put up once again those links. So as we sign off, I wish you a very good day. And here are the links for the topics we discussed today. Thanks for tuning in. See you next time. Bye-bye.